Hi guys, this is Dr. Denise Wong and I'm here today to talk with Yilin. She's one of my patients who I did surgery on in May of last year. Hi Yilin, how are you?
Hey, good. How are you, Dr. Wong?
Pretty good. Let's kind of go back to the beginning in terms of how you decided that you wanted to do eyelid surgery and what made you decide to want to go forward with the surgery.
So since I was little, I realized that my eyes are much smaller compared to other people. But when I was younger, it didn't bother me. As I age, after I had two kids and after I passed 30 years old, I realized that my eye is getting smaller and smaller because aging. The eyelid is a little bit sagging. That's when I realized that maybe I should do something surgical wise.
And in terms of the type of eyelids that you wanted, I know when we talked about during our initial consultation, you kind of had an idea of like what type of eyelid you wanted and kind of your goals for your eyelid surgery. Can you kind of describe what you were looking for and what your goals were for the surgery?
So I did a lot of research online and I looked at different people's eyelid and the surgery they have done surgery, and I look at the different types of double eyelid. And the thing I want, which I mentioned it to you over and over again, is I like the parallel shape because I think that just look very pretty. So that's how I decided. I just from looking at so many pictures, I decided that's the one I like the most.
Yeah, and I know we talked about the different types of creases, and in order to achieve that parallel crease, one of the things we also did in addition to the eyelid surgery was the medial epicanthoplasty, where we opened up the inner corner so that we can see more of the eyelid and have more exposure of the entire eyelid to achieve that parallel look.
Yes.
And can you kind of tell me about, I know currently you're living in Virginia, and our surgery centers in California. So what kind of made you think about coming out of state? How was your decision process about that, and also what kind of made you comfortable in terms of coming over out of state to do your surgery?
I did a lot of research before I decided to come to Vape. There's a lot of surgical center on the East Coast, in DC, New York, Atlanta. But I felt like because it is my eye, is the one of the most important thing on my face. So I definitely want to get it done right the first time. Did a lot of internet search, and Vape just had a great reputation, and I got online onto the website, and then look at your credential. I just think I just like the way your demeanor. I watch your video speaking on the website, and I just felt like your demeanor will work very well with me, and I just like you from a personal level too, because I just think I'll work really well with this doctor.
Thank you so
Yes.
much. I appreciate that. Yeah, I mean, we really appreciate you coming all the way out to California, and it was great having you come in so we could kind of chat. I know one of the things we did, we had the initial consultation over the internet initially, and then when you came over to San Francisco, we talked in person. How was your experience like doing a consultation virtually? While you were in Virginia when we first met, and how was that experience for you?
Ideally, I would love to have a consultation in person, but I think since after COVID, people are getting used to virtual appointments, so it really did not bother me a lot. I think I went through the topic that I would like to go through with you. You spend a lot of time looking at my eye through the video. So I think it worked out really well, even though we could not see face to face.
Yeah, I know with, especially with COVID, I think that having virtual interactions is very common these days, and actually a very useful resource for everybody so that we can sort of keep in contact even though we're not exactly in the same region. Yeah. And then when you came over to San Francisco, obviously we met in person and kind of did an in-person evaluation of your eyelids before surgery. And can you kind of go over how was your experience with that? Did you feel comfortable with what we discussed? And kind of maybe just share how your feelings about your overall preoperative experience.
Yeah, so I flew into San Francisco. By the way, love the city. Had a little tour before my surgery. That was fun. So I came into the office, saw you. I expressed how I want, my eyelid to look like. Of course, the parallel shape. But at the same time, you also gave me advice because not everybody is a good candidate to the parallel shape. So I really appreciate that your honesty because you have seen way more than I have. So what would look best on me, but at the same time, you really just took my advice, took my concern and say, I will try my best to do the parallel, but it really depends on your eye shape. So I think it was a mutual agreement. I can't get exactly the same parallel I want because my eye shape, but I love the end result.
Mm-hmm. Yeah, I think that's good. I mean, obviously we try to communicate with our patients so that we all are on the same page in terms of what you have in mind and what I think would be good, and make sure that the result is what you want. Can you kind of describe your, after we, did the pre-op evaluation and got you ready for surgery, let's talk a little bit about your surgical experience and how that went. Can you kind of describe a little bit about, kind of what went through your mind, during the day of the surgery, and, was it what you expected, and how your overall experience was?
So in the morning, I woke up really early the day of surgery, came to the office, and the whole time I was really relaxing because I think that just the office environment, it doesn't feel like a hospital. It feels like a office that I go into every day. So I was really relaxed. And then when I went to the operating room, I was really comfortable. And the next thing I know, the surgery was done and did not have pain at all through my whole journey, even the day of the surgery.
In terms of after the surgery, obviously you were, out of state, so you stayed at a local hotel. How was that for you? Did you feel okay with that? Were you pretty comfortable in terms of, your post-op recovery, even though you were in a hotel?
Yes. So I stayed in an Airbnb. It's about like a 1 mile away from your office. I think it was perfect because after surgery, the most important thing is that don't exercise, rest as much as you can, ice as much as you can. So even though if I'm home, I would basically do exactly the same thing as I'm in a hotel, which is laying there and ice. I was worried that because before I came to San Francisco, I was like, oh, if they check my ID at the checkpoint, I may look different or I look like bruises and everything. I was worried about that swollen. But the result were so good. 9 days after my surgery, I had no bruise. The swelling wasn't a little bit swelling, but it's not dramatic enough for somebody who didn't know me to notice it.
Yeah, you had a great recovery process, and you did a really great job, taking care of your eyelids and kind of following the directions. So I think that also played a big role in terms of you doing a great job with that. So we appreciate that.
Yeah.
And then, your eyelids look great. How do you feel about your results, and how do you feel now, given that you're now 9 months out? What are your thoughts right now in terms of your overall result?
Yeah, I love it. People who doesn't know me didn't even know I had surgery. Even people who knows me, half of people didn't even ask me question because it looked so natural. It was not dramatic because that was my number one concern is I want to look natural. Naturally, I have a smaller eye shape. So I think if my crease is too big, it will not match with my eye. So I I told you this during the consultation, like number one thing is I want to look natural. So I'm really happy with my result. Look really natural. The only thing I regret is I should got my under eye done there.
Well, you can always come back and visit us again.
Yes, absolutely. Yeah.
Now, yeah, you did a great result. You had a great result, and we appreciate your feedback, and we enjoy having you as our patient. So thank you so much for all your help as well.
You are most welcome, and I tell all my friends that Dr. Wang is great. If you want to get your eye done, give her a call. So I'm definitely your fan. So.
Thank you so much. I appreciate it.
Yeah.
All right. Well, it was great speaking with you. And then
Yes.
we'll be in touch soon. And obviously, if you have any questions or concerns, feel free to reach out to us anytime.